Hi, welcome to our video on mumps disease. This is being created by Group 118. This presentation will be covering the following areas regarding mumps. What is mumps? It is an acute viral infection caused by a negative stranded RNA virus belonging to the genus Rubeolavirus. Humans are the sole reservoir for the virus. The virus is transmitted through direct contact with respiratory droplets or saliva from another individual infected with the virus. Examples would include coughing, sneezing, and sharing saliva. The virus enters the respiratory tract and moves to the nasopharynx, where its protein fuses to the cell membrane, allowing it to enter the cell's cytoplasm. The infected cell is then released and secreted into the oral cavity by the salivary gland. The incubation period ranges from 12 to 15 days. After this period, virumaria, which is the presence of virus strain in the blood, occurs. The virus then spreads to the tissues, which causes the inflammation of the salivary and parotoid glands. The initial symptoms include malaise, body aches, headaches, loss of appetite, and/or nausea. At around 16 to 18 days of exposure to the virus, development of parotosis occurs. This is the inflammation and swelling of the parotoid glands. Mumps can cause complications such as ascipetic meningitis, which is inflammation of the meninges, and it can also cause orchitis in males and oophorectitis in females. It also causes hearing loss and pancreatic inflammation. Orchitis arises 4 to 8 days after parotitis and occurs in only men, with symptoms being abrupt swelling of the testicles. It is the most prominent complication, affecting 6.2% of males with mumps. This can lead to men having testicular atrophy and in rare cases becoming infertile. Mumps can also attack the central nervous system, causing meningitis, which can bring about sensorineural hearing loss, which is caused by the virus damaging the cochlea. Although this complication is rare, it is also profound and incurable. Mumps often shows no symptoms, with complications and long-term morbidity being rare, as it is self-resolving and generally disappears between 7 and 10 days. Although mumps has an incubation period of between 12 and 25 days, 1/3 of mumps cases arise without recognised symptoms. Whilst mumps can induce further and more serious complications, which can ultimately be fatal, the illness is often not harmful in effect. Usually, if a person contracts mumps, naturally they will acquire lifelong immunity, whereas those artificially immunised tend to have a declining immunity over time. A common complication that could occur would be sensorineural bilateral deafness from meningitis. The only treatment for this is cochlear implants. A cochlear implant is an implanted electronic hearing device designed to produce useful hearing sensations to a person who is profoundly deaf by stimulating nerves inside the inner ear. The least expensive evidence-based approach would be firstly the MMR vaccination, which is a preventative strategy. Children aged between 18 months and 14 years are eligible for the first dose of the vaccination. Secondly, supportive medication can be taken to relieve the symptoms of mumps. Symptoms such as fever and headache can be initially treated by taking plenty of fluids and bed rest, or by taking over-the-counter medications such as anti-inflammatories, such as ibuprofen. The best suggested evidence-based approach is the MMR vaccination. It has been proven that most mumps cases affect the youths who have not received the MMR vaccination before. Hence, mumps can be more easily controlled if people of this age group are given the opportunity for immunisation. Lastly, based on study done in Japan, mumps vaccination has shown to be extremely effective in reducing new cases of mumps complication and is proven to be economical. Research from Davis et al. In 2010 highlights that mumps has no specific antiviral therapy, with the only methods of treating it being symptomatic and supportive. We have inferred that general practitioners would be the primary healthcare professional to treat this, as they will carry out initial diagnosis based on history and of parotoid swelling. GPs can also provide supportive treatment plans for those affected, including local measures such as heat and cold packs and prescribing anti-inflammatories. Thank you for listening to our video and hope this helps.